coming in here. Good job. Moose Hill, take it away. You're on the air. Y'all now listening to Moose Hill, all the way from the state of Kansas. Good job.
Ladies and gentlemen, coming in the arena at this time is your Teen Girls Traditional. Teen Girls Traditional, that's his style. Coming behind them is the junior, the Teen Girls Jingle. Looking good dancers, you're looking good.
Get the song ready. We still got our teen categories coming on in. Good job. Here, come on into our junior categories. Welcome, children. Our children, our youth. Our future is coming into the arena here at this time. Good job.
Coming into the arena at this time is your Teen Girls Fancy. Junior Girls Fancy. Come on in, ladies. Come on in. Dance your style. Dance your style.
Good job. Good job. Good job. Hey, what's she down there? Good job. Good job. All our dancers are in the arena. I want to say thank you to each one.
One, two, three. Good afternoon, Winnebago membership, Winnebago community, Winnebago workforce. This is the weekly COVID-19 update for the Winnebago tribe of Nebraska. And I just wanted to start off by acknowledging the mourners again, I acknowledge them again every time. And that we recently had a former council member who is making her journey now, Ramona Wolf, and I wanted to say thank you to her family on the time that she spent at the table. It's a lot to take on all your people's hardships. That it takes a lot, but it's also very special to sit at the table of the Winnebago people's promise and future, and that she did a lot for our people, and it's going to go a long way. And that we're going to continue that. So with that, I wanted to move it along to Danelle Smith, the CEO of 12 Clans.
Thank you, John. Good afternoon, everyone. On behalf of the Winnebago Comprehensive Healthcare System, I want to thank you all for joining today's edition of our live stream COVID-19 update for the Winnebago community. First of all, I too would like to express my condolences to the family who lost their loved one this week. Out of respect for the family, we did move this week's COVID live stream update from yesterday's regularly scheduled time until today at 3 p.m. Hopefully next week, we will be able to get back to our regular schedule of Thursdays. But so I just wanted to make a few points before we move into our presentation from the Winnebago Public Health Department and from 12 Clans Unity Hospital. First, we continue to monitor what is going on in our area related to the COVID-19 pandemic. We look at what's happening across the country, but also throughout the state and our region, as well as, of course, what is happening here in our own Winnebago community. We are looking at what the state of Nebraska is doing, as well as what the state of Iowa is doing. And as many of you are aware, these areas are starting to open businesses back up and are making an attempt to try to make things normalize. The curve is flattening in some areas and the numbers are starting to decrease, which is good news. However, in Winnebago, we are now continuing to see our numbers increase. And so this is something that we definitely need to be paying very close attention to. And I would like to urge the Winnebago community to continue practicing social distancing. After many weeks of going through this pandemic, it's very understandable that people are frustrated and they're tired of hearing about COVID and they're tired of staying home. But even more critical, more so than ever now, we need to pay close attention to what is happening and continue to stay home and only limit your shopping and practice that social distancing, because that is what is truly going to be able to help you protect yourself as well as your family, and to hopefully start flattening that curve and decreasing those numbers in our Winnebago community. The Tribal Council has taken a lot of effort and actions towards trying to address the community and the spread of COVID in our community, as well as the health department and the hospital and all of our other organizations. However, those actions can only do so much. It really is up to each and every one of us to take personal responsibility to follow those recommendations and to do what we can to protect ourselves and our families. And so I would just like to re-emphasize the importance of taking those actions seriously. We do not like to see, our family members be sick, or we certainly don't want to lose a loved one due to COVID. The other thing that I wanted to point out, while we have been taking a lot of effort in the hospital to try to reduce the number of patients and people that are coming through the facility in order to reduce the chance for exposure, I also wanted to share and emphasize that we are also taking a lot of efforts in order to make sure that when you do come to the hospital, when you do come to the clinic, or you have to see a provider, that you are protected, that the staff is protected, and that we do have a lot of processes and things in place, and that PPE, the wearing of the masks and that type of thing is in place for a reason. And when those things are used properly, it does help to prevent the spread of COVID-19. And so if you are sick, or if you do have a health issue that needs to be addressed, I also urge you to continue to take care of your health and to make sure that that gets taken care of. And it was just simply a matter of calling ahead and getting instructions on the best way for you to be seen, whether that's through the clinic or if it's truly an emergency, to come into the emergency department so that you can take care of those things, whether it's COVID related or otherwise. Our primary focus and mission, of course, is to take care of the health of our community, and we want to make sure that we do just that. With that, I would like to turn it over to Mona, the Public Health Administrator, to make a few comments before we go into our presentation for today. Thank you.
Thank you, John and Janelle, for the good words and also for your leadership during this time. I also wanted to share my thoughts and prayers to all of the mourners. So a few things, some of the lessons learned over the past month is that we cannot let our guard down. This virus likes to attack when we are at our most vulnerable, when we take that mask off and we speak with others, when we're running in for an errand and we're standing in line with someone that's coughing without a mask. We continue to be all susceptible, and we have to continue to take the needed precautions. It doesn't mean that any one person is going around infecting people. Many times our symptomatic people do not realize for several days that this may be a COVID infection. They brush it off as a cold. So they might not receive a test because they've recovered. The more that we test, the more infections that we're going to find, and we address them as soon as they surface and as soon as we become aware of them. I know that we have learned so many lessons over the past few months as a community and a people. We are resilient, we are loving, and we're supportive. Currently, we're working on some places to stay for those that are homeless or unable to isolate in their homes. But of course, everything takes a little bit of time. But we are working on it as a team and hope to have some of those ready to be used by early next week or possibly even sooner. I thank each and every one of you for all that you do for us and our community. We are all in this together. We're all working towards a common goal. Again, I want to thank all the staff that are working through this stressful time and all those that work behind the scenes. All of us continue to be at risk for COVID-19 infections. So please continue to stay home, stay healthy, and stay connected. And now, Angie Keller, our Public Health Nursing Director, will start this week's presentation.
Good afternoon, and I want to thank everyone for taking time to watch this. And again, my condolences go out to all those that are mourning the loss of loved ones. For the recent statistics that we have for any COVID-related cases in the United States, there's 15,183,888 total tested. There's been 13,324,920 negatives. There has been 1,858,968 positive cases, and then a total of 98,261 deaths, and that's throughout the United States. In the state of Nebraska, there has been 90,748 total tests completed. There's been 77,802 tests that were negative, 12,619 positives, and then 153 deaths. Within Winnebago, as of today, there's been 139 tests that have been completed. 85 of those have been negative, 25 positives with 8 that have recovered, and there has been 1 death. Currently, there's 29 tests pending. For non-Winnebago residents, so anybody living outside the Winnebago community, there has been a total of 144 tests that have been completed. 96 of those have been negative, and 37 have been positive. And then there's 11 pending currently with those. The next slide is just the risk of exposure. So again, I want to kind of reiterate this so we can stress kind of practicing social distancing since the surrounding communities are starting to open up and the state's starting to open up. It is really important that we do follow our precautions to prevent any exposure. So with that, it's wearing a mask when you're out in public, even sometimes within your household. If there's somebody that's coming to the door or anything like that, put a mask on, and that's going to help prevent, hopefully limit the amount of exposure that you have. But for high risk exposure, that's anybody usually living within the same household or anybody that's been in a had close contact with somebody. So that is contact within somebody that's been 6 feet or less for greater than 10 minutes. And then also there has been no mask worn. So if you wear a mask and you're having a close contact, that can decrease your exposure, chances of exposure, but there still is a possible exposure, but it does decrease it. So in here, the circle, it shows those that have been in close contact or that are at high risk with that positive individual in the white. And then the ones that are low exposure are ones that had very short interactions with a positive individual or had interactions with a contact of an individual. So they would be like a contact of a contact. Sometimes if you think of it as like a chain, the first link is that positive person. We focus on that next link, which is their close contacts, and that link after that would be the contacts of those individuals. So the COVID hotline is up and going still. It's 402-922-1508. The hours of operation are 8 to 8. You can call that with any questions you have regarding COVID, if you have symptoms, if think you might have had an exposure, anything regarding COVID. The information we'll get from you every time that you call in will be your name, location of residence, so we can make sure that if information is needed or if other resources are available at an area that's closer to your residence, we can definitely help facilitate that as much as we can. The reason for your calling, and then if any symptoms are present or if you've had any known exposure. That just gives the people running the hotline a better idea of how to handle each situation. But again, hours are 8 to 8, and then call with any questions regarding COVID. And next will be Lauren. She's going to go over the 12 clans testing prioritization and process for you guys.
Okay, thanks everybody. It's a nice sunny day out, and hopefully everybody's having a good day. You know, we've gone over this a few times, but we seem to always get testing questions, and I think it's very good that people ask those questions. So we'll go over it again. But you know, not everybody needs tested for COVID, but testing is not an emergency situation. If you do need tested, most people will have mild illness and can recover at home in self-isolation without medical care, and they may not even need to be tested. If you think you need testing, please call the COVID hotline. If this is after hours, you can leave a message just like Angie went over, and they'll get back to you. If you're experiencing an emergency and you need care, that is when you need to utilize the emergency department. And Danelle stressed that if you think you need emergency care, please come to the emergency department. We've taken every step to ensure that people are safe when they come to the emergency department, and that our staff is safe also. Please inform the screener that you're wanting to be seen in the emergency department and that you're seeking emergency care. Those coming to the hospital just for testing will be given instructions to call the hotline or their primary care provider, so an informed decision can be made as to if testing is warranted. Those living in the same household or who have worked with someone in close contact that is COVID positive will be advised as to when and if testing is needed or when it is to be performed. All right, the types of testing, people ask about that. What types of testing do we have at the hospital? So we do have a rapid test, and those, we do get those tests back very quickly. We may need to test you again, depending on clinical symptoms. So know that if you get a rapid test, there may be a validation test with that. So you might get 2 swabs. We currently are using these tests as much as possible when it's applicable. We don't use the rapid test on people that aren't having symptoms. So if you come in and you're needing a test because you're in the same household, or maybe you live in a congregate living center and you don't have symptoms, we're probably going to have to send that in, and it's going to be 24 to 48 hours. And that's when we use the commercial and state labs. They really are getting our testing back very quickly. So we get them in as soon as we can, and then as soon as the providers get the results, we try to get a hold of you as soon as possible. We do have more testing supplies that are available out from the commercial and the state lab testing. We are getting a little bit more all the time. Test Nebraska is another area that you can go to at www.testnebraska.com for more information to see if you would be eligible to be tested at their sites. Okay, this is a new slide for this week, and I wanted to go over with people. How do we deal with employees that may have been exposed to COVID or are in the testing process for COVID? We take this very seriously, and we spend a lot of time on this. Just as Angie does contact tracing in the health department for the community, we do the same thing in the hospital. And we have this entire process written out so that employees know what they need to do if they think they've been exposed. One of the things that we do is we do screen every employee, and that means they get a temperature, plus we ask the screening questions. If they answer yes to any of those or they have a temperature, they're sent to their car immediately. And we have picked up on some employees that were not allowed in the hospital because they screened positive and were sent home. So anyone having employee, if they suspect they have symptoms, then they're supposed to report the situation to their supervisor and the employee health nurse. And then we have a COVID testing team that determines their exposure risk by using the following criteria. How long were they exposed to the individual that has COVID? How close was the individual to the exposed person? Is the person living in the same household? That creates a whole different issue. Are there increased COVID cases in the area? Was protective equipment worn when they were talking to those exposed people? Is the person having symptoms, and when did they start? Next, we look at the exposure risk and the exposure date, and that decides if testing is warranted. We don't want to test too soon. If the exposure was yesterday, we don't want to test tomorrow. We want to make sure that when we do test, that we're getting a good test. Low risk exposures will be allowed to work with self-monitoring and wearing appropriate PPE. That doesn't mean they have COVID. They're not COVID. They had a low risk exposure. If there is a medium or high risk exposure, you'll be asked to go home immediately or stay home until testing is back or symptoms have resolved for a period of time. And the employee health nurse will be calling them on a daily basis. You may be asked to quarantine for 14 days, and the employee may be asked to see their personal care provider. Once the employee gets tested, and we usually use the outside testing for that, you'll be asked to self-monitor and contact the employee health nurse with the results. The COVID testing team will review each exposure on a case-by-case basis. We do not use employees' names. Return to work depends on type of exposure, time of exposure, living situation, and testing results. You may be asked to contact your local health department. Those with positive tests or who have had high-risk exposure may be asked to have 2 negative tests in 24-hour period before coming back to work. All those returning to work will have to be fever-free for 72 hours and have lessening of symptoms. The employee health nurse will direct you and your supervisor as to when you can return to work and under what circumstances. So as you can see, we have a very, very detailed process, and we meet continuously and look over the employee lists. We went over these last week, and we had some screening updates and visitor policy. And really the biggest thing is that we're going to take every patient's visitors temperatures at the door. I know people are not liking that, but it really, for right now, that's what we feel we need to do. So we would just ask everybody to comply with that. We wipe everything off after each use, and we use different thermometers until those are clean. So please, if you have questions, let us know, but we follow all the guidelines on that. The screener will ask patients and visitors to put one of our surgical masks on. We've had a few people come through with masks on, but there's not a real good seal on them. And if a patient is unable to navigate through the hospital, we'll provide staff to help them with that so that they don't have to have a visitor coming in with them. And then the visitor policy is pretty much still the same. And I know that's hard. It's very hard. It's hard for us. We want to let people in, but at the same time, we need to keep people safe. So our staff is doing a really great job. We respect the community support, and thank you very much. So this is the end of our presentation, and we'll do question and answers at the end. And if you have a question, go to covid@winnebagotribe.com and you can put them in the chat feature.
Yes, I am. Okay, thank you. All right, good afternoon. I would like to thank everybody for joining us today. And before I begin, I would like to offer my condolences to those who are in mourning. Our thoughts and prayers are with you and your loved ones during this difficult time. For today's update, I'll be sharing information on the funding that the tribe has received so far to support our fight against COVID-19. The funding that the tribe received is to support the Winnebago Tribe of Nebraska's prevention, preparedness, and response to the COVID-19 pandemic. The tribe received $1.5 million distributed through the Bureau of Indian Affairs. These funds were approved by the Tribal Council to support a variety of projects, including support for community members to sew masks, hardware and software to assist with teledistance work and other IT-related needs, rent relief for tribal housing, the purchase of PPE, including disposable masks, hand sanitizer, and other sanitizing supplies and funds to support the tribe's food security project. Additionally, the tribe received $58,399 in funding through the tribe's PL 102-477 Human Services Program to assist with burial assistance expenses and general assistance for human services for the Human Service Program. The funding will be split 50-50 between those two areas. On Friday, May 22nd, the Tribal Council approved the budget for the first round of funding that the tribe received from the U.S. Department of Treasury through the CARES Act. The round one funds totaled just over $6.2 million. The second round of funding should be made known sometime after June 5th. The budget for the round one funding was completed with collaboration between the Winnebago Tribal Council, staff, the tribe's pandemic task force, and the various subcommittees formed to help address this unprecedented pandemic. The subcommittees were formed to work on different areas of need within the tribe and the Winnebago community. The areas covered by the subcommittees are food security, communications, utilities, security, and education, as well as the needs of the tribal departments, including the health department. Tribal departmental needs, including hazard pay and the sanitization of buildings, were part of the approved funding. The budget will also provide funding to support the food pantry through an agreement between the tribe and the Atlas program. The funding will directly support the purchase of PPE for tribal departments, as well as providing additional storage space for the Wildlife and Parks Department. Other items in the budget that will provide funding to purchase minor equipment and supplies to support the tribe's food security initiative, additional funding for IT to assist with telehealth and equipment for the hospital was also approved. There was funding for the tribe's enterprises, including HCI and Winnebago, to help pay for increased cleaning and sanitization needed to help keep the customers and employees safe during this time. And finally, the tribe will be providing funding to the community schools for PPE and cleaning supplies, as well as the laptops that were requested by the public school. As always, please continue to check the tribe's website and Facebook page for updates. Please continue to stay safe and have a nice weekend. And that concludes the update for the tribe. Thank you very much.
All right, thank you, Esther. At this time, we're going to turn our attention to the Superintendent of the Winnebago Public Schools, Mr. Dan Farringer.
Good afternoon, everyone. First of all, my condolences to all those in mourning for the loss of loved ones. The second thing, I would like to express my thank you to the following staff for many years of experience here. They're going to be leaving us. They're retired. Mr. Meddy, Mr. Ross, Sandra Kai, Holly Humphrey, Mr. Fate, and Mrs. Kendra. About 150 years of experience are leaving us this year. They're officially completed now. So that's going to be a big loss for the school, and we'll have some big shoes to fill. Again, thank you to those staff members. We plan on getting the waivers out next week. We finally received them back from our attorneys for the athletes and parents to sign to use the weight room. We're looking at opening the weight room on June for conditioning and weight room purposes only on June 8th. We'll have more information coming out next week with the protocol. The administration, along with other members of the community, are continuing to work on plans for what next year may look like as far as the guidelines that are going to be in place during that time. We're working on bringing small groups back in. We got some guidance for how we can bring small groups of kids back into school for the summer. So we're looking at hopefully having some summer school services for those that need some academic help starting on the week of June 22nd or soon after that. And weather permitting, the track and playground area should be completed very soon. That will be a great, it will help the visual, just beautify the school district and our facilities up here. And hopefully next year we'll be able to use those as we continue to work toward that. Again, continue to be safe, and we'll practice our safety up here and social distancing. Thank you.
Thank you for the update. And as always, those that are retiring and the years of service, we appreciate them. And we wish everybody a happy retirement that's going to be retiring from the Winnebago Public Schools. At this time, we're going to turn our attention over to Manoj, the president of Little Priest Tribal College.
Good afternoon, everyone, community members. Before I update about the Little Priest happenings, I just want to share my condolences to the mourners and to the loved ones. I pray for safety and health for everyone. So here are some major updates from Little Priest Tribal College. Our summer online 2020 started, the first ever semester, which is completely online. And I'm very happy to report we had a record enrollment of 107 students. Our previous highest was 59 students, and our last summer was 37 students. So we have almost tripled our enrollment because we are offering free classes and then, of course, free tablets to all students. So great news from the college. Today is our last day for the census date, so we'll get exact numbers on our summer 2020 enrollment. But as of yesterday, it was 107. Next update is on a fall semester. We are discussing whether we are going to be offering face-to-face or online classes. That will be a very significant decision from the college. First, Higher Learning Commission has to approve online instruction by providing a waiver to the college. as of right now, the waiver is only up till August 31st, 2020. We're also working with United States Department of Education to make sure that we get the waivers just in case. We will be updating the community on when that decision will be made, hopefully very soon. We are also working with the public health officials, CDC, to make sure the rate of infection is tracked to make a decision of whether face-to-face is conducive for our students. We are keeping safety as the paramount factor in decision making. Our fall schedule is released to the public. It may change based on face-to-face versus online. Same with the academic calendar may change. Just like many public universities and colleges, we may start the school a little bit early and end before Thanksgiving. Again, this is something we are discussing. There is no decision has been made as of right now. We are per public health and other CDC health agencies, they are expecting the second wave to hit summer, December, January of 2020, 2021. So keeping that in mind, we have to make some very hard decisions about the modality of the instruction. College reopening plans. When the rate of infection goes down, staff members will be coming to campus on a rotational basis. We have created our rotational matrix already, but we are, as Janelle Smith pointed out, the rate of infection in Winnebago is increasing, and we are going to look into that data before any decision will be made on getting the employees back on campus. As of right now, we are looking in July as the possible rate of date of month of return. LPTC will set up checkpoints at the entries to have only one entry, and there will be health screening checkpoints for all employees coming to the college. No visitors, family members will be allowed on campus. There has not been any decision made on the public library on the campus yet. We are happy to share that Morningstar Little Priest Tribal College has completed their MOU with Morningstar Counseling for employees, current employees, students, and immediate family members for health services, telehealth services, mental health counseling. So please contact Tricia Wagner, Director of Student Support Services, if you need more information. LPTC continues to offer online community education workshops. Please contact Jennifer Smith if you need any if you have any additional questions, or if you're interested to attend any workshops. LPTC graduation information will be shared very soon on Facebook pages and our website. Last but not the least, one of our employees who had tested positive has completely recovered, and we are very excited to share that that person is back to work. So again, on behalf of the college and from my side, I wish all of you very safe health, and our, again, sincere condolences to the community members who have lost their loved ones. Take care and have a good weekend.
Thank you, President Manoj. We appreciate the update and congratulations on that enrollment, and we wish everybody happy learning on their summer schedule. At this time, we're going to turn our attention over to Mayan Beltran, the General Manager of Winnebago Casino and Resort.
Good afternoon. I'd like to offer also my condolences, sincerest condolences to the mourners and the families at this time. So at Winnebago, our commitment to health, safety, and sanitation. We will continue to closely monitor industry and government guidelines as it relates to COVID-19, including information provided by the Winnebago Tribe of Nebraska, Centers for Disease Control, World Health Organization, and the Iowa Department of Health. We have created guidelines to ensure the health and safety of our associates, our guests, and our community, as well as sanitation procedures to be followed to prevent transmission of the virus. Today, we had a meeting with Tribal Council on the reopening, and we will remain closed at this time over concerns of rising COVID-19 cases on the Winnebago Indian Reservation. Although the casino is located in Sloan, Iowa, many of the casino employees live in Winnebago, Nebraska. The Winnebago Tribe of Nebraska oversees and has full authority over Winnebago's casino resort operations, and the Winnebago Tribal Council met today and agreed to keep the entire resort closed until further notice. The Tribal Council is scheduled to reconvene on June 12th and will reevaluate reopening the casino resort at that time. This was a tough decision, but this is all about protecting the safety and well-being of our employees, guests, and surrounding communities. We will continue to monitor the data released by local and state public health official agencies, and we will make a decision to reopen when we feel confident that our community as a whole is safe. Casino management will continue to utilize social media and their website, winnevegas.com, to communicate and inform the public of any new developments. Thank you.
Thank you for that update, Mayan. We appreciate it. At this time, we're going to turn our attention to Sam Burrish, the Communications Manager for HoChunk Incorporated. Sam.
Thank you, Garen. Good afternoon. First, on behalf of HoChunk Inc., we'd like to express condolences to all the families in mourning, including the Wolf family. On the business side, we're developing a company-wide work plan, so the way we work at each location continues to be safe and is responsive to fluctuating local situations. Our employee donations program, for some good news, announced its recipient organization for this year, which is the Winnebago Youth Shelter. In the past several years, HoChunk Inc. employees have helped raise $125,000 for local community organizations through the donations program, and we look forward to helping the youth shelter make facility and other improvements. Our ambassador program is currently hiring. These are flexible part-time jobs available to individuals living on the Winnebago and Omaha reservations. Please see the HoChunk Inc. careers page or contact Janelle Decora for more information. We'd also like to remind the community the federal stimulus payments via prepaid card have started to arrive, so go through your mail diligently if you are expecting payment that way. Also, scammers are continuing to take advantage of the pandemic, so please be cautious about any attempts to contact you. Finally, I'd like to turn things over to Brian Mathers and recognize him and his staff at HCCDC for their work on the Farm to Families food distribution, which has been taking place on Fridays. So those are my updates, and Brian, feel free to go ahead.
Thanks, Sam. Yeah, we did do a distribution this morning. We doubled our number of boxes from last week from 80 to 160, but they were still gone within a half hour. There's a high need. We're checking to see if we can get additional pallets of these boxes on our next shipment. And I apologize for people that weren't able to access them. They came, we were expecting them around 9 and they brought them at 7:30 in the morning, and we had to get them out quick because it's perishable stuff. So we did some Facebook notice that we'd start early, but some people missed out and didn't get up there in time, and I apologize for that. We'll try to both increase the number and also hopefully we'll be able to be better at predicting the time that they'll actually arrive and distribution has to start as we do this a few more weeks. So those are really good nutrition resources, and keeping healthy food and incorporating it into our diet is one of the things we can do to stay healthy and be more resistant to catching COVID-19. This is a limited project, but there are we're hoping there will be other sources of fresh produce going forward throughout the whole growing season this year, because the farmers market is going to be launching on the 17th of June. And I've got a new opportunity related to that to people that are interested in becoming a vendor at the farmers market. We applied for some special COVID-related funds from the Native American Agriculture Fund that were available. And we just found out yesterday that we got that. And one of the things we'll be able to offer is grants, not loans, but grants to Native folks that are interested in being vendors at the farmers market. So if you're planning to do that anyway, and you could use some extra capital to increase your inventory or buy some supplies or some display items or something to preserve food or package it, and you needed some funds for that, this might be a good opportunity for that. You have to be Native American, you have to be engaged in agriculture or growing food or some other viable food-related enterprise. It doesn't have to be your main source of income or anything like that. And you have to be registered as a Winnebago Farmers Market vendor. And if you want to do an application for that, you can just contact Tony Wood at HoChunk Community Capital. There's an email, twood@hccw.org. I think Garen is sharing a flyer that we have about that has that information on it. So basically, if you email him and tell him you're interested in one of the grants for vendors, we'll send you a very simple grant application for that. And then we'll be reviewing the applicants and distributing the money to the ones that, as much as we'll spend it all out as quickly as we can. And since the farmers market is going to start on the 17th, we'd like this to happen quickly. So contact Tony if you're interested in that. And we hope that that's a way to keep the growing going and to keep that pipeline of fresh produce coming into the community, even after the farm food program ends later this summer. So that's really all I've got this week. Condolences to the families that are losing people or that are ill, and stay strong, stay healthy, and just keep taking care of each other.
Thank you, Brian. We might have some questions a little bit later regarding the Friday produce. So if you don't mind staying on the call here. At this time, we'll go into the health questions, and we'll turn it over to Emily to lead us into the health-related questions. Emily.
Thank you, Garen. Just a reminder that you can submit your questions on the chat box of both YouTube and Facebook live streams, or email your questions to covid@winnebagotribe.com, and we will do our best to answer them. So thank you to everyone who had submitted questions on the chat and through email. I'll kick it off with the first question. Where is 12 Clans Clinical Director, Dr. Noisy Hawk? She seems like she could offer some expertise. Danelle, can you answer that one for us?
Yes, thank you. So first of all, our medical providers are directly responsible for patient care, and they do participate in all aspects of COVID-19 care for our patients. And they are also responsible for helping with the planning and response at the hospital. On occasion, we have invited nurse practitioner Sarah McIntosh, who is part of our medical staff in the emergency department. She has been, as she's available, able to participate in our live stream. And so we thank Sarah for her willingness and her expertise. Sarah is very knowledgeable, and she's very involved and active in our COVID-19 response. And so it was determined that Sarah would be appropriate to come and join us for the live stream and offer any expertise and to answer questions. With regard to our clinical director, the 12 Clans Unity Hospital is actually in the process of recruiting a new permanent clinical director. And in the meantime, we are also in the process of onboarding an interim clinical director who will fulfill that role during this time. And the new clinical director will be introduced and will be on site starting in June.
Great, thank you, Danelle, for that information. Second question, I heard one of the ER doctors at 12 Clans has COVID. Is this true? Please disclose any information if staff have COVID. We don't need names. We just need to know what is being done about it and what policy is being set up so they don't spread the virus. Laura, I know you mentioned this kind of touched on it in the presentation, but did you want to add to your answer? Or...
Yeah, I'll just add to it quick. We do take every employee that comes into the facility very seriously, and we have a process that we go through, and I went over that. We have not had a COVID positive provider at 12 Clans, and so you can be assured that we have strict screening processes for employees, and everything is reviewed. We do test our employees who are symptomatic and are at home if they need to be tested and to see if they have been exposed. And many times it's been a community exposure. If the tests come back positive, we do have them off work and we follow the processes that I outlined earlier.
Great, thank you for that answer. Next question. It seems that a majority of people are getting the virus from hospitals or elder care facilities. This question is in two parts. First, can we prevent tribal members from being sent to Omaha or Sioux City? Laura, can you answer that one?
Yeah, I can take that. First of all, I haven't really heard of patients getting COVID in hospitals. They are real good about using the PPE, and I know nursing homes are working on that very closely. But many of the people that come into the ED need to be transferred for a higher level of care. And right now, we do transfer to Mercy, St. Luke's, and Omaha. They have processes in place for PPE. They have enough PPE. They have assured us of that. So we don't have the level of care that they have to keep them at our facility. They need a lot of oxygen care. Some of them need the ICU. A lot of them need ICU. And so we do need to transfer some of those patients. As far as nursing homes, you know, the nursing homes, I think public health departments, the state of Nebraska has been working with nursing homes. They have teams that go in and help the nursing homes right now with their PPE, and that is getting better. But you should, before you know, when you talk about your loved one being in a nursing home, you should ask them, do they have the appropriate personal protective equipment, or do they have policies in place to, you know, isolate people that are COVID? And those are questions that can be asked before your loved one goes into a nursing home.
Thank you. In relation to that question, the second part of that was, could we set up a place somewhere on the reservation to house all the patients? Mona, do you want to address that? Because I know you were working closely with that.
Yeah, so we are in the process of setting up several options for either isolation housing for those that are unable to isolate in their current home, or those that are homeless that are positive. So we're trying to work through all of the logistics that are needed, such as basic necessities for those residents. We're also trying to make sure that we get their immediate needs met. So we're trying to work out all of those basic information. And then of course the housing would only be available for the duration of the quarantine period, which of course would be worked out with the public health nursing or our other nurses as needed, depending, and everybody's different on how they react to the virus and what their length and duration of symptoms are. So of course, we'll be monitoring each of those individuals very closely as we do, regardless of whether we have them in a separate place or not.
Great, thank you so much for that information, Mona. Next question was put on the live stream chat. What technology is being provided to elders in the sick leave so they can access telehealth? Laura, can you answer that one?
Right, we do have processes so that if someone needs to have access to telehealth, that a CHR can go out and take them a laptop, or I think we have iPads that they can use. We are trying to work on some connectivity issues right now with our telemedicine. And so hopefully that will be fixed within the next week. We're trying different things so that those, when we do connect, that we have good connectivity, and it's a good process for those that we work with. Now, if someone has questions, they can always call the clinic and we can get them set up, or we can talk to them about how to get connected for telehealth.
Great, thank you. And I believe, correct me if I'm wrong, Mona, too, the CHR program is working with the hospital to deliver those devices, correct?
Yeah, so the CHR program will be informed of the telehealth visit, and then they'll probably make contact if the elder or the patient contacts the CHR program to let them know that they do not have a device at home, but want a telehealth visit. They can, as Laura alluded to, bring out an iPad that can be used. And of course, the CHR will just hang out outside until the visit's done. Or they could, if you prefer to use your own phone for the visit, we can activate our hotspots on the CHR phone, and then they can do the visit, and then we still hang out outside until the visit is completed. So we're just trying to make the technology available for those that are needing it in the way that they're most comfortable in using it.
Great, thank you both for that insight. And then the very last question we have through the live stream was concerning the deaths in relation to COVID in Winnebago. The individual wrote, I thought there was at least 3 deaths COVID related. Why does it only say 1? Mona, can you address that?
So the statistics that we provide for the community, we look at those individuals that live within the community within Winnebago for at least a month prior to their testing. So if they test positive and we are monitoring and then they have died, then they're counted as our death. We do not monitor every enrolled Winnebago at this time for their COVID status, but I think that would be an excellent partnership with perhaps the life insurance program to look at that data in the future and track that as well, because that's valuable information to know.
Okay, great. And then we did just get in another question. So before we wrap up, somebody wants to know if we could do appointments by phone, telehealth appointments by phone, or does it have to always be video? Laura, could you answer that?
Oh, they are doing some appointments by phone right now. So it really depends on the provider, what they can do by phone. So the patient just needs a call, and the provider will decide with the nurse if it can be done by phone or not. But it has worked in some instances.
Okay, great. Well, thank you all very much. That concludes all the questions we have for this week. Again, please email covid@winnebagotribe.com if you have any questions, and we will answer them in our next live stream next Thursday. Thank you all, Laura, Mona, Danelle, Garen.
Thank you, Emily. We do have one question that just came in for the health officials here. If you guys can oblige us here. This is, heard the National Guard is coming in to test next week. Is this true?
So we are still looking at working on the logistics of all of that. We are attempting to be able to do that. We're working with the Northeast Nebraska Public Health Department in order to provide those services. And it would be in conjunction with the Omaha Public Health Department as well. So we're working on it.
Thank you, Mona. Appreciate it. At this time, we'll go over. And folks, stay tuned. We do have a guest that is a survivor of COVID, and we're going to be going into the questions for the Winnebago Pandemic Task Force, as well as Chairman Coley Brown. Coley, your opening statement.
Good afternoon, everybody. Thank you guys for sticking it out. Thank you for all the work that you're doing. And thank you for the condolences and the thoughts for the families and those that are sick with this virus. It's a bumpy road that we're on. Kind of at a loss for words how it's going with us, but we'll keep the faith and rely on our Creator and our Savior to get us through this. Again, thank you very much for all the work that you're doing today and for the future for all of us. Thank you.
Thank you, Chairman. We'll get into our first question here. We do have John Snowball, Chairman Brown, Esther Mercer, the CEO of the Winnebago Tribe. Can you please communicate all of the giveaways, food drives, and anything related to COVID? My family is all confused on if they are eligible or not. Seeing that you have to be an elder, have to have a certain income guideline, have to live on or live off the reservation, it's just ridiculous. Just go straight across the board, every tribal member, period. Can someone address that?
I can try and answer that. So far as I know, there was only been one giveaway with Atlas, and that was for our elders. Most of all, it has been across the board. They can't serve everybody, so it's kind of a first come, first serve. And our awareness to notify our people is an issue. Not everybody has Facebook, and we need to work on that somehow, some way, so everybody is aware of what's going on. There was issues with the Boys and Girls Club were doing a wonderful job this past week, and they might continue into next week. I want to thank them for that and the hard work they've been doing. They've been out there every morning into the afternoon providing for our children. It was 18 and below. But as far as I know, it is across the board. I haven't heard of no income requirements, eligibility to affect that.
Thank you, Chairman. Next question. Why is Winnebago and HCI employees getting hazard pay, but not the tribe and the hospital? The council should make it equal for all entities, and it should be up to the council to set those rates.
I could take that one, Garen. So we have different entities, HoChunk Inc. and Winnebago Casino and 12 clans, and we have our tribal employees, and they're different funding structures, and some are capable of things that others aren't, and we have had that discussion to make sure that it's comparable. It's comparable what kind of hazard pay we're paying out, and as far as the Winnebago tribe, I know that we approved that policy, that hazard pay policy this morning. So we're really looking to move forward with compensating our frontline employees who are taking risks, our police officers and the wake and burial and facilities and all those ones who are at risk, who are continuing to do their duties for our people. So those talks have happened, and that's moving forward.
Thank you. The next question. Since the motion failed to reopen Winnebago this morning, when is the next time that they will vote again?
So I think Mayan had a pretty good explanation of what happened this morning, and that we wanted to reevaluate and visit it again in 2 weeks. And I think I think it was a real good thing that we did that, and that it was too soon. You know that I'll take this time right now to thank Mayan and his team and everything that they did. They gave us a lot to consider today. You know, it was above and beyond. You know, I would go to as far as saying that they did more than anybody was going to do to give us the option of reopening. But the council felt that it wasn't time. You know, it was too soon, and we need to view it more. And our community is on the rise. You know that those cases are going up, and that our casino is special. That our community and a people is tied to that casino. You know, that's why that casino is there, to take care of our people. And I think it's real good that the way the casino is going to take care of us is to remain closed. That's the way they're going to take care of us at this time. Thank you.
Thank you, John. Thank you, Chairman. That is all the questions that we had so far. Folks, if you have any more questions for the tribal officials or health officials, you're more than welcome to email COVID@Winnebago Tribe. At this time, we do have a COVID survivor, Mr. Terry Medina. Terry, are you on the line?
Is he around? Okay.
Can you hear me?
Yep, we can hear you, Terry.
Okay, good. Sorry.
Terry, you still there?
Yeah, I'm here.
Okay, the floor is yours. We do have a few questions for you, and right now we just kind of have a black screen. We couldn't get your camera up and going and stuff, so bear with us, folks. But Terry, it's good to hear from you. We appreciate you coming on and sharing your experience, and from my understanding, kind of give us what it was like to from start to end to go and face and battle against this disease or this virus, this COVID virus. Terry.
If I started from start to end, we'd be here till about 6 o'clock. So I'm gonna do best I can and shorten it up. All seriousness, it was shocking how fast that virus got me. My daughter got off work from the pony up there at Atticatch, got off work at 4, came home quarter after 4, jumped in bed, was sick, took her meds. Dad, I'm really sick, I got a fever, chills. So she jumped in bed, and I was laying in our king bed. And so 5:45, 5:45, an hour and a half later, it was all over. Fever, chills, nonstop for 8 days. I didn't get tested down in Winnebago till that following Tuesday, but Friday, Saturday, Sunday, Monday, then we stayed in the car and they did the test through the nose, and of course called me back, said I was positive. And so my experience going through this is that the virus affects everyone differently. And Sandy Anderson, and then the other girl that was on, the community health nurses, they just call me every day, checking on me. You got to stay hydrated. You got to drink Gatorade, water, juice. I was doing everything, and yet my fevers were so high. And then that, I think the following week when I started getting, my breathing was labored, I swear to God, it took all I could muster to take a bath. I was so out of wind. And so by the time I came back to the hospital in Winnebago, and they took my blood and sent me up to Mercy, to the COVID unit, to be admitted. And the doctors telling me at Mercy, even though, not just myself, but even though a lot of people take the Gatorade, the water, the juices, stay hydrated, my fevers were so high that my body was totally dehydrated. So I was there Wednesday, Thursday, Friday, Saturday. So I was on continuous IVs, not just in one arm, but both arms. Praising God, thanking Creator that I didn't have to go on the respirator. They put an oxygen mask over me. And the 24 hours I was in that oxygen mask really, really helped. But for me, it was 8 days continuous fever, chills, could barely, I couldn't even make it to the bathroom. I had to have help to get over there. And it was just unbelievable experience, and not, today just, looking at Coley, looking at people here, looking at my nose. I'm thankful and grateful to be here talking to you to address this. And so to me, like I said, it affects everyone different. And so I'm glad the doctor put me in the hospital, being on the IVs, being on the oxygen, I think gave me the boost. And so finally, it's my second week back to work, praising God that I can smell and taste again. So that was, it was just an unbelievable experience. And like I said, my whole family got it, except my youngest son, Andrew. He, 16, kind of barricaded himself in his room, so he's the only one. But we all came out of it. I think I was the worst. I battled it for 18 days. I just couldn't shake the fever. So I've been telling the people, shoot, if you're not doing good, go back to the hospital and get checked out, because I think the IV medicine that they gave me really helped me, because my fever is 104, 105, it just never left me. And so for me, being a survivor, like I said, my spirituality really kind of helped me, and I wasn't really worried about myself. I put my
my life in Creator God's hands, because all the prayers that went out for me was it was just unbelievable, totally unbelievable from all over the country. And so a power of prayer, Creator God, He blessed me just to be here a little while longer with my wife, my children, my grandchildren, to do the best I can for them. And being back, serving the relatives through probation, through choices, through fatherhood, motherhood, sacred, working with youth. No, it's a whole nother testimony. Because I tell the people every day, it's a teachable moment, and it goes back to choices. Being smart, wearing that mask, staying isolated. And for me, going through this, man, I pray every day, put tobacco down, sage out. My relatives are going to sweat lodge tonight. And so that power of prayer is powerful. So for me, like I was preaching to my children, preaching to everybody, man, look in the mirror, look at yourself, make good choices, be smart, and be available. I've been here now for 30 years at the court, been in the community for about 35 years, and this is a beautiful place to be. A lot of people have compassion. They really look out for the relatives like that. So I have nothing but gratitude to 12 Clans, for Sandy Anderson, everyone that called every day, checked on me. But yet, at the same time, you got to be smart. You got to be smart. Like I said, I went to Walmart last night, first time in a while, and people, no masks, everyone congregating over there. So to me, I'm still trying to heal. I'm not 100% yet, so I'm trying to get back to that. But where I was at, it was a dark place, a very dark place, and I've never experienced nothing like that in my life. And so to me, even being a diabetic, it goes back to choices, because I told the relatives I had a roommate that worked at Tyson. He was 56 years old, Hispanic guy. And so when we got the masks off, we got to visiting one of his good brothers from Tyson. He said, if you'd have seen him, 42 years old, just muscled up, healthy. He got the COVID on a Sunday, and he only lasted until Thursday. He died that following Thursday. And so the virus is nothing to play with. It's wicked. And so with everyone, like I said, we got to look in the mirror and make choices every day. And so my choices are to do my best for my family and try to get well. And then I was all fired up, go out to Winnebago, but I guess got to wait a couple more weeks. So to me, that's what I try to do. I'm just thankful every day. Now it's like my patience for my grandchildren are even greater, because Creator God, He could have called me home, and I've been gone. So I wasn't worried about myself. I'm not scared of death, so I can go through that door. But what we're sad about, we're worried about our wife, our children, and grandchildren. All the preaching and teaching, I always tell my children, I'm dead and gone, you're going to realize what I try to teach you. So being a probation officer 30 years, to me, it's all about choices. Every one of you guys I'm looking at, from Brian all the way down here to Mona, like I said, we make choices every day. And you as the decision makers have a tough job. Have a tough job to make decisions on behalf of the relatives, and like it or not, we can't always point the finger. We got to look in the mirror and point the finger at yourself, because we're in charge of ourselves, and the choices we make is very critical. So even before I got the virus, every day I'm preaching and teaching, praying for people, trying to empower them to make a change in their life. And so for me, it's all about spirituality. It's all about Mauna, Tekantala, Wakanda, Pusha, whatever name you give Creator, Jesus Christ. We have to have that spirituality inside of us. And so I have, nothing but love for all my relatives here, and going through this whole process. Everyone's been beyond supportive for me. So I'm just, like I said, I'm extremely grateful today just to be talking to you guys. Any questions?
We appreciate it, Terry, and it's good to see that you're back to work. And definitely, we thank the insight, as well as the advice to keep up the prevention work for everybody related to this virus. And so, Terry, we're glad that you're still with us, and we're glad that you survived it. And we appreciate you coming here today to share your story with us.
I will say one more thing. Being home since February 24th, I've only worked 4 weeks, and so I'll be 66 years old this October 4th, and I'm gonna tell you right now, man, I'm not gonna retire, man. I swear to God, every day I'm getting addicted. Jerry Springer, Murray, Steve, you are not the father, so I'm getting carried away. But I I can't understand how people just sit there every day. And myself, since my house was bad, that's the only choice I have. But shoot, I can't be sitting home, man. So I'm gonna go as long as I can. So God bless you guys. Thanks for listening to me.
Thank you, Terry. At this time,
Hey,
we're
Terry, nice to hear. Terry, nice to hear from you. Terry and me are ping pong buddies, so it's great to hear from him.
Yes, Manolo, it's good to see you.
Aaron,
Yep.
can I say one more thing?
Chairman Brown.
Thank you. Terry, it is good. It's great to hear from you. I said earlier that this virus hit home. It hit home double for me. It's in my family, and it's not in my household, but it's in a household of my family, and that's what I was worried about. The sickest of the sickest, you know, are diabetics and stuff, and I really didn't want that. I have, in my own household, I don't need two people getting sick with this, but then people, they're getting better, and I believe they are going to survive this. And that makes me very happy. And then to see you and hear you today, Terry, that makes my heart feel good. It's good to hear. I was really worried. But too, I want to say, those that are listening, what the council did, they kept our casino closed. But come Monday, June 1st, Nebraska is opening up. So please try and stay home yet. There's no need to go. You know, don't go to North Sioux City. Don't go to Sioux City. Continue to stay home with us. It's just going to spread. It will. Our numbers will rise. That's it. Have a good day. Have a good weekend. Appreciate all of you and love you very much.
Thank you,
sir.
At this
Thanks,
time,
everyone.
final remarks by Winnebago Pandemic Task Force Chairman John Snowball.
Thank you, Terry and Chairman Brown for those words, and I'm going to try to do my best to pick up on those words where, you know, that things are opening up, and you know, me myself, I kind of had a fun summer planned, you know, softball and sand volleyball, but I'm not going to do that. You know, I'm not going to take part in that. I'm going to be responsible, you know, responsible for myself and my family, and responsible for anybody who might come in contact with me. You know, we got to keep going, and thinking about that, and thinking about the curfew, and how that's becomes a part of my life. You know, I try to use the curfew to be better, and 7 o'clock I'm home, and you know, I try to do my yard work, and I try to work on things. You know, something that I probably couldn't have done before, that I wouldn't have done before. How I can grow as a person and go through this, and it's real valuable, and how the curfew's lifted at 5 a.m. and I try to get up and be up around that time, and how the first birds are starting to sing at that time, and it's real powerful to say your prayers, and that like Terry said, it's real powerful. So continue to pray and understand that, and it makes me think of our teachings. You know, how they're real powerful for us, and they've carried us a long way, and how they're timeless, you know, that they're applicable to all times. And one of our teachings, and sometimes, you know, you tell stories during certain times, or certain times they tell you to sit still, and how they're real simple, but they take care of us. And I think about that, you know, I think about that this is a storm, you know, and it's gonna pass, you know, and all we have to do is sit still, and how those teachings are powerful. And they're applicable, you know, any time. They're timeless, and they're applicable today. So that's the way. Those are my thoughts, you know, and how we continue, and how we can. Each one of us can grow as a person during this time. You know, we can continue to grow, and utilize the time that we have, and so I'll say that much, and continue to practice them safe measures, and protect yourself and protect your families. You know, take responsibility for each one of us, that we can protect each other. Thank you.